I am so excited for match day coming up on March 21st. I feel like it's just this culmination of so many years of training and so much expectation to just finally be able to be in the field that I want to pursue, to be with all of my classmates, all of my friends on this exact same day, and just open it together and see exactly where we're going to be spending the next 3 to 7 years of our life, depending what we're going into. I'm applying to a residency in obstetrics and gynecology. This one actually kind of came as a shock because I came into medical school wanting to do anesthesiology. But once I did that third-year rotation, I just fell in love with the field. I fell in love with women's health care, the fact that you can do primary care as well as surgical management for these patients. I really love that you're able to be with them at some of the happiest moments of their life from the obstetrical standpoint. And then you're also the person that if anything goes wrong, you're able to help manage that definitively for them and support them through anything that they may need.
I'm applying emergency medicine because I really like the idea that I'll be the first provider to see patients as they come into the hospital. I think it's really important that as physicians, we see everybody and anybody who comes in. And as an emergency physician, we are compelled to do that. I really like the idea of being able to use my hands, but not having to be stuck in an OR all day. I like that it's such a team sport and that I'll be working with all the providers and be able to have a hand on the patients throughout their entire stay in the hospital.
Hey, I'm Jared. I'm one of the fourth-year medical students matching into family medicine. So I chose this specialty specifically because I do love primary care. I love talking to people, if that's not obvious. I like hearing their stories and seeing kind of what brought them there. I spent a lot of time in an inpatient setting. I was a nurse for 6 years and kind of seeing all those patients that were admitted for things that were very reversible or things that could have just been avoided completely if they had some health education. So I think kind of focusing on that and doing a lot of preventative care in the community and making sure, people don't end up in the hospital, kind of, improve outcomes that way.
I'm excited to share that I am pursuing pediatrics as my future career. And I'm super excited to be a future pediatrician and taking care of children of all walks of life. I have been significantly impacted by the pediatricians in my life growing up, and the care that they provided me and my family was so impactful that really stuck with me. And when I wanted to pursue medicine, pediatrics was definitely a top choice for me to pursue. Working with pediatricians throughout my clinical years, I've really found a passion, an undercurrent of passion and advocacy that all pediatricians have to advocate for their patients and their families. And it's such a privilege to be able to work with underserved populations and be able to provide care for those families.
I'm going to be applying in for this cycle into psychiatry. What really inspired me to pursue a career in psychiatry was my time spent here with the Gregorian School of Medicine on my clerkship rotation. Going in, I didn't really think of too much about psychiatry as a specialty until I had a wonderful experience at our Mojave clinic. I got to follow this single patient for 6 weeks, got to see a terrific transformation in the clinical space. And I knew that unlike any other specialty that I rotated with, this is something that I could see myself doing for the rest of my life. I was inspired by one of the child and adolescent psychiatry fellows that I worked with there that this really seems like a therapeutic space that I want to be a part of. I want to help give back to the Las Vegas community and really pursue that through a career in psychiatry.